Greetings, everybody, and welcome to Silverio Lining. Today we're going to be talking about pediatric mathematics. I had a great pediatric rotation as a medical student, and I also had a fabulous time in residency working with pediatricians and with small adults. I enjoyed talking to parents about their worries and their hopes for their child. What I goddamn hated was doing pediatric math. It was like every single patient I saw, I had to do an equation, and it just about made my head explode. It may be the reason I chose to do emergency medicine instead of pediatrics, so I guess there's always a silver lining. Fortunately, as emergency medicine physicians, we don't need to know so much PedsMath. However, I do think that there are two basic situations that we need to have pat in order to be excellent physicians and provide good patient care.
Let's start with a case.
You have a 6-year-old girl whose name is Alicia. She's had a fever for the past 3 to 4 days. Her mom says that the fever's max out at about 103.4, and she's giving her a teaspoon of Tylenol every 4 hours like clockwork, and it is just not cutting it. This obviously is the common scenario. You're going to be seeing this patient every single day for the rest of your life, and you need to know how to manage them quickly so you can do a back-of-the-napkin calculation of dosing without leaving the room. This will save you 3 minutes of patient and probably hours and hours of your life. So let's start by calculating how much we think Sylvia is going to weigh. There's a great technique called the hand tubby technique that calculates weight for a patient based on their age. All you need is your hand. Starting at your thumb, you assign your thumb 1 and you go across to the pinky just using odd numbers. So it is 1, 3, 5, 7, and 9. This is for the age of the patient. In order to calculate the weight, you then do the same. Start at the thumb, start with 10 kilograms, and then move across, adding 5 kilograms for every digit. This means that a 5-year-old will be 20 kilograms, a 7-year-old will be 25 kilograms, a 9-year-old will be 30 kilograms. Sylvia, from our case, would be about 22 kilograms because she's 6 years old. Now that you've figured out the weight of your child, you want to understand the dosages and then also the concentrations of the medications that you're prescribing. There are 2 common antipyretics in pediatrics, acetaminophen and ibuprofen. We'll start with acetaminophen. Both pediatric and infant acetaminophen have the same concentration. It is 160 milligrams per milliliter. They used to be a different concentration, but after a rash of iatrogenic pediatric poisonings from infant acetaminophen being inappropriately given as pediatric acetaminophen, the infant acetaminophen was pulled off the counters. You also have infant and pediatric ibuprofen. Pediatric ibuprofen is dosed at a reasonable 100 milligrams per 5 mils. But infant ibuprofen is significantly more concentrated, running at 50 milligrams per 1.25 mils. This is mostly because when you're taking care of an infant, you're going to be dosing it in drops, and 1.25 mils is approximately 1 drop. Finally, you need to know your dosing. Ibuprofen dosing for peds is 10 milligrams per kilogram, not to exceed 600 milligrams. Acetaminophen dosing for kids is 15 milligrams per kilogram, not to exceed 650 milligrams. Great. Now that you have your estimated weight, your dosages and concentrations for both ibuprofen and acetaminophen, you can tell the parent how many milliliters they need to give Sylvia. Our Sylvia is 6 years old, so she weighs approximately 22 kilograms. For ease, we're going to round that down to 20, which is what I would do in the real world as well. The dosage of acetaminophen is 15 milligrams per kilogram. 15 times 20 is 300.
So she needs 300 milligrams.
That's going to be about 9 milliliters. Here's the part where you morph in the parent's eyes from a fine doctor to an amazing doctor. How many parents have a graduated cylinder at home and can measure 9 milliliters? None. How many parents have teaspoons at home? Pretty much all of them. How many parents have tablespoons at home? All of them. There are 5 milliliters in a teaspoon and 15 milliliters in a tablespoon. So Sylvia should be getting slightly less than 2 teaspoons of acetaminophen. You tell the parents that, the parents know the dose. Sylvia doesn't come back until she sprains her ankle 3 days later. Let's work on a completely different kind of case. Trauma alpha is a 3-year-old unrestrained male who was involved in a motor vehicle accident. The only information you can get from the paramedics is that he has thready pulses, is saturating 90% on 100% non-rebreather, and is very altered and non-responsive. Let's assume for the sake of PedsMath that the child needs to be intubated. What size endotracheal tube do you need? Pretty much everybody knows the equation age over 4 plus 4 equals the size of an uncuffed endotracheal tube. That's the appropriate tube size to use and tube type to use for pediatric patients less than 7. You can start using cuff tubes for pediatric patients older than 7. But for that, you need to subtract 1 from the age equation to get the appropriate size. For our patient, who's a 3-year-old male, he would be getting a size 5 endotracheal tube. After you've intubated, you notice that his abdomen is distended and taut. You're not sure if that's from overzealous bagging en route to the hospital or a peritoneal abdomen. You need to place an orogastric and nasogastric tube. If you multiply the size of the uncuffed endotracheal tube by 2, you'll be able to calculate the size of an orogastric, nasogastric, or Foley catheter for the same pediatric patient. Let's say you've placed an orogastric tube, got out a fair amount of gastric contents, and seen a vast improvement in abdominal distension in trauma alpha. How do you know that you've placed the tube too far? It's very easy in pediatric resuscitations to get overzealous with intubation and push the tube into the right main stem. An easy equation to prevent that from happening is the size of the uncuffed endotracheal tube times 3. That's where the tube should be at the teeth. Now that you've verified placement using your fancy pediatric equations, you'll get a chest x-ray and notice that trauma alpha has some significant hazy opacities in the right lung and continues to be saturating poorly, overall concerning for a hemothorax. You need to place a chest tube. But how do you decide what size chest tube to use? The way you calculate the size of the chest tube is the size of the uncuffed endotracheal tube times 4. After you've placed the chest tube, the patient's oxygenation improves, and you're able to get him safely to the CT scanner